Are you concerned that your penis has a slight curve? If so, it could be a condition known as Peyronie's disease. I'm Dr. Rena, a urologist and pelvic surgeon, and today I'll be explaining everything you need to know about Peyronie's disease, also referred to as penile curvature. Be sure to watch until the end of this video, because I'll also share some of the most recent treatment options based on research published as recently as 2020. Peyronie's disease is an inflammatory condition that leads to a bend in the penis, and in certain situations, it can also result in deformities or even erectile dysfunction in more severe cases. It was first identified back in the 1700s and is estimated to affect roughly 1 to 13% of men. The actual number is probably higher, but many individuals avoid seeking medical help due to the embarrassment linked to the condition. So, what signs should you look out for? You might notice a curve in the penis to one side, upward or downward. In some cases, there may be a visible deformity, giving the penis an hourglass-like shape. In the early stages of Peyronie's disease, you may also experience pain during erections. This stage is known as the acute phase. The reason this condition develops is believed to be due to small, repeated injuries, or microtraumas, to the outer lining of the penis, called the tunica albuginea. These minor injuries can occur during intercourse. As the body heals, some individuals, especially those prone to inflammation, develop scar tissue, or plaques, instead of normal healing. This condition is seen more often in people with a genetic predisposition, including those with a history of Dupuytren's contracture, which affects the fingers and hands. Now, how is it treated? During the acute phase, when pain is present, doctors usually recommend non-steroidal anti-inflammatory medications, such as ibuprofen or similar over-the-counter options, to help manage discomfort. There is also some evidence suggesting that extracorporeal shockwave therapy, applied to the penis, may help reduce pain during this period. However, it's important to understand that these treatments do not stop the curvature from developing. They mainly help relieve pain. After about 6 to 12 months, the pain typically subsides, but the curvature remains. This stage is referred to as the stable phase, and it is during this phase that most treatment strategies for Peyronie's disease are focused. There are both surgical and non-surgical ways to treat this condition. The main non-surgical approach usually involves intralesional injections, which means medication is injected directly into the plaque itself. The three most commonly used medications are collagenase, interferon alpha-2b, and verapamil. For most of these treatments, the typical side effects include bleeding, swelling, and pain at the injection site, although some side effects may vary depending on the specific medication used. One important thing to keep in mind is that there is a very small risk of what's called a corporal rupture, which is essentially a penile fracture. This is considered a medical emergency, and if it happens, you should go to the emergency room right away. Early research on these injections shows that they can improve curvature by about 17 degrees. Curvature is measured with a completely straight penis considered as 0 degrees. If the curvature is more severe, surgical options are also available. One option is called plication, where stitches are placed on the side opposite the plaque to help straighten the penis. Another option is excision and grafting, where the plaque is removed and replaced with tissue to correct the curve. Interestingly, in 2020, a study looked at traction therapy for Peyronie's disease. In this study, men were divided into groups and asked to use a traction device called restorex for different durations: 30 minutes a day, 60 minutes a day, or 90 minutes a day, for 3 months. Researchers then measured changes in curvature, erectile function, and penile length. The results were quite promising. Even with just 30 minutes of daily use, traction therapy improved curvature by about 18 to 22% and increased penile length by around 2 to 2.3 centimeters. Most participants did not find the device too bothersome, although some reported mild discomfort or slight redness. Overall, patients tolerated the therapy well without major issues. This makes traction therapy a very encouraging option for individuals dealing with Peyronie's disease. If you're experiencing this condition, it may be something worth considering. I'll include the study and device information below so you can explore it further. And as always, remember to take care of yourself, because you truly deserve it.